Until he can actually see the wound, Tom doesn't know if Daniel has cut an artery or is in danger of losing any fingers.
Okay. All right then.
Ambulance services, the patient breathing?
Yes, he's breathing. He's fell off some scaffolding.
Okay, how old is the patient?
He's 74. He's gone very pale.
Okay. The emergency ambulance has been arranged.
Back injuries are among the most common major traumas and can be life-changing. It's estimated that every 4 hours someone in the UK is paralysed from damage to their spine. With a chance he could be seriously injured, critical care paramedics Stephen Mitchell and clinical team mentor Ben Reen are dispatched.
We are going to a 74-year-old who has fallen off some scaffolding boards, approximately 12 foot height, and apparently landed flat on his back. He's complaining of back pain and arm pain. So the risk is that he's got a spinal injury, really. His age brings something into that as well. Any pre-existing medical conditions like osteoporosis, brittle bones, they make a big difference.
Ben and Mitch are first on scene and find the man in his front garden.
Hi there.
What's your name, sir?
Paul.
Paul. I'm Steve and this is Ben. How old are you, if you don't mind me asking?
74.
74.
Paul had been trying to repair some rotten wood on his house when the scaffold tower he was standing on gave way.
You look like you're in a bit of pain there.
Yeah. I've got a nasty gash on my finger.
Yeah. And where's the majority of pain?
Across my back and in the hip.
And with regards to the pain in your hip, is it on the same side as your back? Or is it the other side?
Side.
Left hip, OK. We'll just go and have a quick look at your back and left, OK.
Whilst we're doing that, can you tell us what happened?
Yeah. I was on the platform up there.
Stood up.
Yeah. Stabilisers were all out. And for some unknown reason, it just started to go that way.
Yeah.
Twisted around, and I fell onto that bar on the back.
Were you knocked out at all?
No, luckily.
Good.
Yeah.
Saves that.
Bloody hell. No.
All right, pop your blood pressure cuff on there.
Where possible, the advice after a fall like Paul's is to stay still, because moving can cause injuries to worsen.
The reason I got up was because they were worried these plants might fall off on me.
OK, gotcha.
Fearful of the scaffold boards falling, Paul's wife and some nearby workmen moved him to safety.
When they assisted you up, did you move anything by his own means, or...?
Not a lot, no.
No, OK.
Mitch and Ben decide to leave him sitting.
You're fine as you are. We'll work around you.
Okay.
All right.
Are you short of breath at all?
No, it's painful to breathe in.
Just painful, OK. You might have done something with your ribs at the back. Can you try and push down on your leg as if you're going to get up, but I don't want you to get up like that, OK. Right, we'll get you a little bit of oxygen and I'll just go and get some painkillers out of the car, OK?
Thank you.
All right.
The pain in Paul's chest points to a fractured rib.
Pop this on.
Is he normally quite a pale complexion?
Yeah, he's pale, but he's got
Yeah.
his paler than normal.
Mitch calls the control room to request an ambulance.
Could do with an ambulance. Patient's got shortness of breath from pain, along ribs.
A spinal injury also can't be ruled out.
Would you like that as a red or an amber backup, over?
I'd probably put it as a red. What were you trying to do then?
All the wood's rotten. I was going to replace that
Yeah.
and then paint the house.
Paul is in a lot of pain. He needs a scan to determine whether he has broken any ribs and to make sure he hasn't damaged his spine.
Did you want to do cannula and stuff like that? Yeah, sound.
While they wait for an ambulance, Ben and Mitch are doing everything they can to make him more comfortable.
This arm's not sore, is it?
No,
All right.
Only below the elbow.
I'm going to pop a needle in one of these veins and we'll get some pain relief in, all right?
Okay.
All right, little scratch coming up, OK?
Yeah.
Ben inserts a cannula into Paul's arm so that painkillers can be administered straight into the blood.
Are you allergic to anything at all?
No.
Have you had any paracetamol at all?
No.
OK. It's paracetamol.
Lovely. Thank you.
Feel that go in.
Although it's just paracetamol, it works really well, actually, through the vein. Yeah. It should be a bit quicker for you.
Out of 10, how bad would you say the pain is? 10 being really bad.
Oh no.
Pardon?
A red 7.
Although Paul's putting a brave face on it, he's still in agony.
Ever had morphine before?
No.
No.
Morphine sulfate, 10 milligrams 1 mil, 223.
Is that easing off a little bit there?
Yeah. No, it's only when I pass it up I'll get the time.
Okay.
Finally, the pain is beginning to subside.
We're just waiting on the ambulance now, all right?
Yeah.
Paul will be taken to the nearest hospital, where he'll be x-rayed to find out exactly what damage he's done.
Hiya.
I don't think he's going to be able to move too far, so I think if we bring the stretcher like right up next to him, stop there a sec. I think come back a bit, that's it. Yeah, perfect.
As they are confident his injury doesn't involve the spinal cord, Ben and Mitch help Paul to get himself onto the stretcher.
Brilliant work. Well done, Paul. So your head goes that end.
Going up this way, yeah.
And then we'll bring your
Hold
feet
your
up.
back if you've got the legs.
Okay. Keep your feet together. Keep your feet together. That's it.
Will he have to stay in?
We don't know. It's completely up to the doctors and what they see and what they find.
He was clearly in a lot of pain and he may have some rib fractures. Hopefully he hasn't done anything to his lung or anything like underneath.
Ambulance service, patient breathing.
He's come off his push bike, he's unconscious, he's breathing, all his teeth are gone and everything. He's in a bad way, his face is at the road.
And does he seem to be taking regular breaths?
He's breathing very fast.
Is the patient in the road?
He is in the road, yes.
How old do you think he is?
I'd say he's in his 60s. Not tall, his teeth, certainly.
We've got an ambulance en route, okay, so just keep your eye out for the ambulance.
I will do, yeah.
A local ambulance has already been dispatched to the scene of the accident, but there's a high chance the man has suffered paralysis or brain damage, and his life may be at risk, so critical care backup is needed.
It's come through with unconscious male in his 60s that's come off a motorbike.
60, that's what we see. Thanks very much. I think it'll be about 8 minutes of it.
Critical care paramedics Will Meadows and Colin Apps deal with life-threatening emergencies on a daily basis. Their advanced trauma training gives the most gravely ill the best chance of survival.
Yeah, the information's come through that he's unconscious. That would suggest that he may well have serious injuries, including injuries to his head.
10 minutes after receiving the emergency call, they are on scene. The local paramedics have taken the injured man into their ambulance.
Sorry guys, my name's Will, one of the critical care paramedics.
I'm Joe.
Paramedic Joe quickly briefs Will on the details of the accident so he can begin his assessment.
He's been travelling on his motorbike, no helmet. Push bike, sorry. Yeah, apparently the front wheel has locked up.
Yeah.
He's gone over the handlebars and full impact on the front of his face.
Okay.
73-year-old Fred, a retired crane driver, was riding back home after visiting his 99-year-old mother when the accident happened.
Bystanders state that he didn't move to start with, so we're querying a period of unconsciousness with him. On our arrival, he's sat up, he's talking, he's fully orientated, he knew where he was, but he couldn't recall the incident of what had happened.
Okay.
Fred's injuries are so extensive, he needs urgent hospital treatment and a brain scan.
We've got a good 2-inch laceration above his right eyebrow. Initially, they said that he wasn't moving.
At the very least, he has concussion, but the memory loss and blackout could be the sign of a much more serious brain injury.
Have we found the teeth, or are they...?
Yeah. We've got 3 of them there,
Okay,
yeah.
so there's 3 missing and you found them all?
Yeah,
okay.
The ones at the back look quite broken as well. There's nothing that I can see that's gone through the pallet at the top.
How are you breathing? Is it okay?
Yes.
Yeah?
Yeah.
Okay. Are you in much pain at all?
No, no, fine. Just a little bit of bruise there.
Yeah, try not to touch your face there, sir, okay? Because we don't want to contaminate that, but...
Yeah.
Yeah, you've taken a bit of a beating, haven't you? I think the road's won this time.
Yeah.
Yeah. Okay.
Will is most worried about Fred's unseen injuries. His head took the full force of the impact. Head traumas are very unpredictable, and there is a risk he may have damaged blood vessels that could turn into a more serious bleed on the brain.
I don't know what happened, actually.
No, I don't think you're going to have the answers either, Fred. Accidents happen really quick, don't they?
Will calls into the trauma desk to alert them that Fred is likely to need reconstructive surgery on his face.
He's got split lips. He's had 3 teeth knocked out. They're all accounted for. And his tongue's been split as well, sort of in the middle, and quite aptly described as lizard tongue.
The Queen Elizabeth Major Trauma Centre in Birmingham has specialist maxillofacial surgeons who can assess and treat Fred's head wounds.
Do you want pain relief for you?
No.
No?
No, it's all right.
Fair enough.
Try not to keep dabbing it then.
Amazingly, Fred seems to be untroubled by his injuries. He wasn't wearing a helmet. If he had been, it may have deflected some of the force of the blow and given him more protection from serious long-term brain injury.
If you're getting blood into your mouth, just let it dribble into there. Try not to force the spit, just let it dribble out.
As it stands, he will need a brain scan to rule out any potentially fatal clots or bruising.
How fast do you normally cycle there, Fred?
Oh, no.
It's not got a battery in it, has it, your bike?
No. It's an ordinary racer.
A racer?
Yeah.
Yeah, on his own.
Yeah.
So, yeah.
40 mile an hour then. Head down.
There is still... Trauma desk is going to give them a heads up, so you can be seen sooner rather than later. And if they can't manage Fred, then they'll get him transferred to the QE where you can go. All right.
Lovely.
We'll get out of your way.
I don't know what happened.
Take care. Have a nice day.
All right, Fred, you mind how you go, OK? Next time, wear a helmet.
Yeah, I don't know what happened.
All right, guys, thanks very much. Cheers.
Services the patient breathing?
Yeah, he's had his hand in a steel saw.
A steel saw?
Yeah, it's gone straight through. Yeah, I don't want to describe it too much.
How far through his hand has the saw gone?
Dan, you need to move your hand, please, because I need to describe it to her. I need to put your hand over your face. Hold on. Oh, very, 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 very bad.
We'll get someone to him as soon as we can. Just keep the pressure on the wound, directly on the wound.
An accident with a power tool can inflict life-altering injuries. An ambulance has been called, but they've requested specialist trauma backup, and critical care paramedic Tom Waters is now en route.
Looks like I'm going to be first on scene, and it's someone, they just said he's cut through his hand with an angle grinder. DIY gone wrong. The benefit that I think my team and myself can go to is we can hopefully make that assessment to really identify what hospital is best for that patient.
10 minutes later, Tom is on scene. The local ambulance crew are already there.
Hello? Hi, you're right. So what's happened?
He was cutting the door frame there and went straight through his hand.
30-year-old bricklayer Daniel was cutting the timber on a workbench using an angle grinder with a 4.5-inch circular blade when he lost control and it sliced through his right hand. His wife Stacey found him and has been trying to stop the bleeding.
Okay, and how bad is it before we have a look at it? Is it pretty bad? Okay.
He hasn't seen it.
Okay, what's your name, sir?
Daniel.
Daniel. Do you live here, do you? Is this right? Okay.
Yeah.
The paramedics have been on scene for 5 minutes. Daniel is in a severe state of shock and close to passing out. They've got him to raise his arm above his heart to try and stop the bleeding.
It's fine. Have you got your trauma pack with you, Tom?
No, I can go.
Yeah, I think maybe if you're saying it's quite bad, we'll get our bandages just in case. If you hurt yourself anywhere else?
No.
No, so it's just your hand?
Yeah.
Okay. Do you mind if I...
Yeah.
This impressive towel you got on here.
It's the second one.
Okay. Okay, so what we'll do, before we open it up, we'll get our bandages just in case.
Daniel's in excruciating pain and can't bear to look at the damage he's done.
Alright. Are you all right to come round here and cut his sleeve off? Yeah. I've got some scissors on me, if you want, yeah. So quick. Okay. I know, sorry buddy. We'll give you some pain relief, but what I want to do is have a real quick look at it first.
Until he can actually see the wound, Tom doesn't know if Daniel has cut an artery or is in danger of losing any fingers. Both require immediate surgery.
Okay, all right, bud. You feel me touching you here? Okay.
Daniel has a 3-inch wound, 1.5 inches deep between his thumb and forefinger. Once the towel is removed, it starts bleeding freely again.
We've got that fun for me.
Calms.
Okay, all right. What we're going to do, buddy, is we're going to clean it up. It's in the corner bit of your thumb. That make you obviously know where it is.
Lucky for Daniel, the blade stops short of the bone.
Straighten that arm out for me. I'm sorry. Well done. I just want to straighten this hand for me.
Daniel is fortunate. All his fingers are still there, and there's no obvious nerve damage. The wound will now be cleaned with saline solution and dressed to immobilize the fingers and help stop the bleeding.
It's just obviously in the crease of his thumb. He's got good circulation here. Yeah, and he can feel me touching his hands. Yeah. And it's, yeah, so I think it's just more soft tissue. Yeah. We're going to cover it. Yep. And then I think we'll...
If we just take a picture?
Yeah, that's fine.
One of the paramedics takes photographs of the wound to show to the hospital doctors in A&E so they can assess whether he needs immediate surgery.
Yeah, nice and still.
All right. Keep still for us, buddy. As soon as you've done this, we'll get you some pain relief.
Last year, almost 5,000 people were admitted to hospital following accidents with power tools.
I'm going to bandage that up. Yeah, it's going to be a little bit painful for a little while.
I'm sorry, mate. When you're working next, don't say Monday.
Yeah. It won't be.
I think it probably feels and looks worse than what it is.
Yeah.
I think it needs to be cleaned, it needs to be x-rayed. Yeah. And it needs to be stitched back together.
Cheers for that. I don't know how you lot could look at it, to be fair.
That's all right, mate. There you go. Just take your time, nice and slow. With no rush. Feel right? Let me just walk behind you.
With Daniel now recovered enough to walk out to the ambulance, Tom is happy to leave him in the care of the local crew for the journey to hospital.
He'll go to the local A&E where he'll get it cleaned. He most likely will have some form of antibiotics and an x-ray, and then it'll be decided onto there if he needs specialist care to treat that part of his hand. It's very much in the forefront of our minds that we want him to get the best care for his hand. So he's a young chap, he's a labourer, we obviously need to get him back to work as soon as possible. It could have been a lot worse. It's still going to be a really painful injury, but hopefully I'll have a really quick recovery.
Ambulance service, is the patient breathing?
Yeah, he's conscious. Been knocked off the motor scooter, he's lying in the road.
What's he been knocked off with?
A car, still got his helmet on.
Okay, don't remove the helmet. Any pain anywhere in particular?
In his leg and in his arm.
Help is all arranged for the gentleman. Somebody could kindly remain with the gentleman until help
we'll
arrives.
stay with him now until it gets here,
Okay.
In a collision, motorbikers are in danger of a direct bodily impact. They're 50 times more likely to suffer a fatal injury than car drivers. Faye and Tom are dispatched.
Got a report for the 28-year-old male. He's come off his motorbike. He's got what they're assuming is a couple of fractures.
With Faye and Tom still a few minutes away, an ambulance is first to the scene of the accident.
Just an update for you on this one. They've given him lots of shock and so far 10 milligram of morphine. They said that he's still screaming out in pain.
That's all understood. Thank you, mate. What's his name again?
Jack.
Jack. Hey, mate. How are you? Mechanism-wise, just came off.
Came off the bike. He was doing 30 and hit with this one. Came straight off.
Right.
Everything. Had helmet. Had jacket.
28-year-old Jack crashed into the side of a car which pulled out in front of him, throwing him off his bike. Despite being given Entonox, he's still in severe pain.
So chest, abdomen, pelvis-wise, you're happy? Okay. Mind if I just have a quick feel? Any pain around here? Okay.
Tom first assesses Jack for internal injuries.
No pain in the tummy, buddy? No pain in the tummy? Arm-wise, it look obviously fractured?
I would say it's about there, I think.
Okay.
He does have a suspected fracture in his forearm.
This is up quick with your legs. Oh. Right then, buddy.
So we are quite swollen.
Yeah.
Trying to feel.
It's all right.
And his femur or thigh bone is also broken.
I'm just going to take your shoe off your right foot. Is that all right? Good, good, good. I just don't want to do stuff without your permission. When you have been like manipulated, so was it more significantly anatomically not in the right way?
We've swollen quite a lot. We're also had some considerable spasm as well.
In his femur, is it? Okay.
Yeah, in his thigh.
All right. Okay. Good. Good. So you're happy no other obvious injuries in here?
The femur is the longest and strongest bone in the body, and fractures can lead to life-threatening complications, including blood clots.
Okay, you've had 20 of morphine.
20 of morphine. Cylinder of Ventanox.
Okay.
And gram of IV paracetamol.
Okay. In regards to the pain, it's just too much, is it?
Yeah.
Have you tried to put the Kendrick on?
No.
Okay.
Tom and Faye urgently need to get Jack to hospital for surgery. But to prevent his condition from worsening, they must first realign the bone using a Kendrick traction device.
Jack, we're going to sort your leg out. Is that okay? I'm just putting something on your foot.
But it's a painful process.
Does it work well on Ensox?
It's been working quite well.
Good.
So Tom administers more pain relief.
So what I want you to do is just take some nice deep breaths on that gas in there. Big deep breaths for us, okay? If you happily just hold the femur where it's unstable, I'll do a little bit of traction.
When you're ready.
Yeah, he's aware of it. So
Come on,
let's
Jack,
get,
be brave, good man.
While the traction device stretches out the leg,
Well done, mate.
Tom manipulates the bones back into place.
It is going to be a little bit sore for just a second.
Good deep breath, mate. Doing well, buddy.
Jack's broken his femur or thigh bone, and the team need to manipulate it back into place.
Go on, take nice deep breaths of that good stuff, mate.
It's painful to do, but necessary to prevent blood loss and reduce the risk of complications.
So he's probably got a bit of spasm in his leg.
Yeah.
Well done. A bit more, Faye, if you can.
Nice deep breaths,
Okay.
Jack's taking deep breaths of Ventanox or nitrous oxide to manage the pain.
That's it, one more.
That's nice. That's looking good, actually, Faye.
Nice deep breath.
Pretty tight, isn't it? Yeah. Looks matching, doesn't it? He's got a bit of a bend in his leg.
Good man.
There we go. Well done. Okay.
Now that his thigh bone's realigned, Jack's condition should start to improve.
Is he a little less in discomfort? James, ask him.
Yeah. Is that a little bit better?
Jack, you're listening.
Instead, he stopped responding.
Open your eyes to us, buddy. I just want to have a quick chat with you. Hello.
Jack, come on. Jack, you all right?
Jack, you all right, mate?
Jack, you all right?
You're all right,
It's because he's taken a lot of Ventanox, so he's just coming round.
Try that again, he's already done a bottle.
The pain relief has left him momentarily dazed.
Jack, which foot am I touching? Your left or your right? Good, well done.
Okay, brilliant. How are you feeling?
I feel a lot better in my leg now.
Pardon?
My leg feels a lot.
Good, good. That's what it's meant to do.
It feel much better once we've done it.
You ready?
Yeah.
Okay, on three.
Right,
One,
I'm going to pick you up, Jack.
2, 3.
Jack now needs to have surgery as soon as possible.
Looks a bit pale, doesn't he?
Yeah.
Let's just get him in the back then.
Yeah.
See how we are.
You all right, mate? See you soon, bud. Yeah, man.
There we go. It's a little bump, buddy. Just nice and slow. So he seems in quite good spirits, doesn't he? He's definitely got a bit of a bow, but yeah, I think no compared to what it was.
Once at Birmingham's Queen Elizabeth Hospital, it'll also be confirmed whether he has any other internal injuries.
You can feel me touching your feet. Brilliant. And just finally, what am I doing just up here? Yeah, good, okay.
In the meantime, the critical care paramedics have done all they can to put him on the road to recovery.
Jack, take care, buddy. We're fairly confident he's got a fractured forearm and a broken fractured femur. He'll probably need an operation, which he'll get either tomorrow or tonight. And then I think he'll have quite a good recovery.
Ambulance service, is a patient breathing?
Yes, he is. What's happened is he's a tree surgeon. He's fallen from the tree.
Yeah.
And impaled himself on a steel spike that was below it.
Okay, is he conscious and awake?
Yes, he's conscious and awake, but the spike has gone through towards his kidney area. They've got him off it. They're trying to put some towels on to stem the bleeding.
Did he look extremely pale?
He does look extremely pale, yes.
Yeah, okay.
He's now going paler every minute.
Of course, so we do have an emergency ambulance arranged for him, okay?
As this is a potentially life-threatening accident, Tom and Ben are immediately dispatched.
So we are going to a report of a 60-year-old male who has fallen out of a tree and impaled himself on some sort of spike or some metal. We are looking at some quite significant potential injuries from both the fall and the impaling of the spike.
Patient seems very pale, more paler by the minute. They're using towels to stem the bleeding. Patient now off the bar that impaled him.
No worries, thanks, Colin. So we've also got 03, which is one of the helicopters coming as well, just in case he's really quite poorly. Tree surgeon. I'm going for the tree surgeon.
Do you reckon?
I think that's a sensible option, isn't it?
Tom and Ben's colleagues, the air ambulance critical care team, are already on scene.
Hello.
Dr. Ali Hussain gives Tom a quick update on the patient's condition.
Hey guys.
You're right.
Hey. So 3 holes.
Hi, mate.
2 flanks. Okay. 1 midline.
What's your name, sir?
Alan.
Alan.
64-year-old tree surgeon Alan was cutting back branches in a client's back garden when he lost his footing.
It feels difficult to take a breath in. It's okay.
Alan fell 12 feet onto metal railings, which embedded themselves in his lower back. The homeowner called 999.
Take a big breath in for us. Do you find it's catching you?
Dr. Ali is worried that one of the spikes may have punctured a lung.
In terms of chest, air entry's good. Belly is tender.
Yeah, fine. It's a bit difficult to know how far they've gone in. It looks like it could have gone in a bit further. But at the minute, the breathing's okay and everything. So, but we don't know how far it's gone into your chest, okay? So we're going to get a drip in, okay? Just reduces the chance of any bleeding, okay? How is your pain at the minute? Roughly out of 10, would you say?
Yeah, I think probably if we could.
If 10's the worst possible pain you could have, and 1's very little. Out of 6. Okay.
We'll get some TXA in.
Yeah.
The team are concerned about the level of damage the 4-inch spikes may have caused Alan's internal organs.
Yeah, what actually happened?
I was in the middle and I just stepped over it and just landed on the spikes.
Ben fits a cannula so drugs can be given intravenously, while Tom updates the trauma desk.
So this male is probably in his late 50s, 60s. He's fallen and impaled himself on a metal spiked fence. From visual inspection, he's got 3 punch wounds, central back, lumbar region. So currently just getting some IV access, giving him some TXA and doing some clinical observations. Currently, the aircraft has landed probably about 200 metres away.
Alan is given a drug called tranexamic acid, or TXA. If he has internal bleeding, this will help the blood to clot.
You know when you're sort of like squeezing your bottom together? Can you do that for us?
Squeeze together,
yeah,
right?
Good lad, that's fine. And you feel everything down below where you sat on?
Dr. Ali checks if the spikes have damaged any nerves in the spinal cord, which could lead to paralysis.
You're sitting on a bicycle seat. You can feel everything there, in that area.
And then everything, yeah. It's really kind of... Yeah. Now, you sure we can't give you some pain relief? Yeah. No? Right, okay. They're pretty nasty things to fall, aren't they?
They are.
We give this antibiotic, sometimes a bit stingy. Okay?
Yeah, no.
Is that the Paramedics?
Yeah.
Coamoxiclav is a penicillin antibiotic. This will fight any bacteria that was on the metal spikes and help stop infection.
The ambulance has just pulled up. We're going to bring their stretcher to the patio. Gentle walk, take a seat, and then we'll pop you over to the QE. Is that all right? It's because of the nature of, well, first of all, if you look, then the spikes have gone in quite a few inches. So we'll take you to a trauma centre, okay?
Tom, Ben and the air ambulance medics are happy that Alan travels to hospital by road.
Copy of the odds for you as well.
Swing your legs.
Tom will travel with Alan to the Queen Elizabeth Hospital to provide advanced critical care if required.
So, we've got, in regards to pain relief wise, we can give you a bit of morphine en route if you're happy, or would you like some pain relief? You sure? Okay. If that changes en route, then just let us know and we'll go from there. This is a dangerous job you guys do, isn't it? It's naturally gonna...
Very often anything.
No.
Very rare, but that was just... I just tumbled out of the tree.
Yeah, yeah. And if that fence was there, you'd have been fine.
Yeah, if I'd landed a few yards.
Absolutely. Yeah. You'd have just got up and carried on cutting. How did you get yourself off?
I had a tiptoe on my feet.
Really?
To lift myself off the spikes. Because I couldn't pull because they were...
No, because they were inside here.
Alan may be putting on a brave face, but his injuries are profound. Tom will be keeping a close eye on his condition in case he deteriorates.
I'm just going to take your blood pressure again, if that's all right. That's going to go a bit tight on your right arm, that blood pressure, just taking your blood pressure, okay. Right then.
Only a scan in hospital will confirm whether Alan has damaged his spine or any internal organs.
2 on the side don't look too bad. I think the main one's been in the middle of your back. Yeah. But the fact that you've walked and you've moved and you've got no pins and needles in your arms, on your legs or anything like that. No, does it feel okay? Good. So that's the only thing they need to be quite, we need to be quite careful about. But you're normally fit and well. You don't suffer from any medical problems or... Oh, you look it, to be fair.
Arriving at the Queen Elizabeth Hospital, Alan is handed over to the waiting emergency team.